Let me take you on a journey to explain my experience getting stem cell treatment for my injuries for the first time. You see, for years I've been suffering from a herniated disc in my back and a torn meniscus in my knee. It's kept me from doing the things that I love, and it's kept me from performing at 100%. But after my stem cell treatment, I'm back on my feet. I'm back to performing at the highest level. I finally feel like I'm 100%, and I'm building confidence in my body each and every day. And this is without any surgery. The first 2 doctors I saw told me surgery was the only option, and there's no guarantee that it would be 100% successful. Not to mention, once they cut into you, you're never going to be truly the same. Well, these answers weren't good enough for me. Athletics is my life, and even with sports aside, you need your body in your lifestyle. It's the vessel in which you get to experience this life. So whether you're walking around the city, whether you're on vacation, you want a healthy vessel so you can have a pleasant experience in life. That's why I'm so glad that I found the doctors at STEMS in Miami Beach, because I was able to avoid surgery, and like I said, I'm back to 100%. I feel great, and I didn't have to go the route of months and months of recovery, of the doubt of wondering if the surgery was going to be successful. Instead, we use stem cells that are already in my body, extracted from my bone marrow and injected into my troubled areas to start the regeneration of the tissue so that I could start to heal in a more natural way. And it was so successful. And I want to take you guys on a journey to explain exactly how easy this process is, so that if you're suffering from an injury as well, you could stop hesitating. You can avoid the aggressive surgical routes, and you can pursue another option. Let me show you guys the process.
So this is just 1% lidocaine, and we just want to line up the iliac on the iliac crest straight down to bones. So really want to get the needle in there, lift up the periosteum to numb that area so the patient doesn't feel this. So now place an 11 gauge stroke guard straight into the site, and now just, light pressure to kind of get through the periosteum into the marrow cavity. The most important here is just take our time, take pictures, make sure we're on a medial to lateral trajectory so that you follow the anatomy. So these are 10 cc cylinders preloaded with heparin. And so with just simple aspiration, pull back, and then you can see good bone marrow coming back. So we pull 5 cc's, rotate the syringe 90 degrees to get more coverage, and 10 more cc's back. So all our good bone marrow is in the 60 cc syringe. Everything in here is sterile. She's going to pass off the 60 cc syringe to Joel, who can then take it for processing.
All right, so we have Adam's bone marrow aspirate here. This is what we call BMA, bone marrow aspirate. Dr. 𝗥𝗲𝗄𝗆 did everything he could to get the highest quality BMA. He did all of the appropriate steps in aspirating from different sites, different depths, 5 cc pulls, turn 5 cc pulls. That's how to get the best foundation of the bone marrow. So we're going to concentrate it by spinning it in the centrifuge. So first we need to filter the bone marrow to make sure there's no bone spicules in it. We're going to use this 270 micron filter to do that. We now need to place that into our concentrating device that's going to be centrifuged. Close our lid here and start our spin. All right, here we go. We've got a nice separation there. So we need to make sure we take all of the important components that Dr. 𝗥𝗄𝗆 needs for the treatment, and it's going to have all our growth factors, our mesenchymal stem cells, hematopoietic stem cells, progenitor cells, everything he needs to get a good treatment. This is our final bone marrow, and then we're going to transfer that into syringes that Doc is going to use to do his injections.
So we're going to target the set joints of his low back on 3 levels on both sides. Bone marrow product going into the spine, pushing half a cc. So we're going to make sure to get a good spread to cover all the tendons, the ligaments in the spine, and all the surrounding muscles to get a good spread and coverage. As you know, Adam also has a lateral meniscal injury. We're just prepping and cleaning right now. Again, sterility very important. And we're going to do the lateral meniscus for him, as well as an intra-articular knee injection as well. Adam, how you doing?
I can't tell if I'm dreaming or if I'm awake.
So everything went great. The bone marrow was perfect. You're going to have some really good results, I think.
A little groggy, knees a little sore, but I'm thinking backflips tomorrow. No, just feel pretty good, excited for PT. Let this stem do its job. But right now, I'm taking a nap. I'm done.